Hi, my name is Dr. T.K. Gossett, and I'd like to welcome you to my peripheral neuropathy video. I'm a licensed chiropractic physician in the state of Illinois and been in active practice since 1978. About 10 years ago, in 2005, after about 25 years of practice, I decided to take some postgraduate study and step up my game in order to help patients with chronic and severe conditions. So what I did was study to improve my diagnostic and treatment skills to help people with these types of conditions that were not getting help, that were not responding to traditional treatment protocols. Now, as a result, I've developed several different programs, treatment programs, that are effective in reducing these patients' symptoms and giving them a better life. Here in the central Illinois area, I've been able to help thousands of people and have now produced some programs that we can use nationwide and even across the world. Some of these programs are at-home programs, others are intensive programs here at the office, which last 1 or 2 weeks. We can talk about more of that later, but the main reason you're here is because I imagine you or a family member or someone that you care about is suffering from peripheral neuropathy. Now, this reminds me of a patient. His name is Thomas. He called about a year ago and came in with peripheral neuropathy of his feet and secondarily a little bit in the hands. He started out with symptoms of numbness and tingling in one foot, and then it gradually worked its way up to his knee, and then in the other foot, and that also developed numbness or gradually progressed to where it involved the knee. Then he developed weakness in his thighs and his leg muscles, and as a result was having difficulty standing for long periods of time, getting up and down from a seated position, going to social events, and even having difficulty with his balance and coordination. So his last visit before he came to me was to his specialist who he'd been to for a year or more, and he stated to him that, Thomas, I've done all I can do. There's really nothing else I can recommend for you. This condition is progressive, as you can see, and it's only going to get worse with time. You're just going to have to learn to live with it. Now, that's not an answer that I would want to accept or want any patient of mine to accept. So we'll talk about the end of his story in just a few minutes. But you probably have 2 questions for me right now. How are you, Dr. Gossett, different from any other doctor that I've seen or heard about? How are you unique, and can you really help me? Well, how am I unique? I'm unique in the way that I use very progressive procedures of examination and treatment. Those are based on the newest research that's available. The problem with most doctors, 95% of the doctors, is what medical research shows us, use examination and treatment procedures that are 15 years old or more. That means that only 5% of the doctors are even aware of these newer treatment procedures, and many of them overlook or ignore them as well. Now, what I do also that is unique is that I focus on 3 major systems or groups of systems that the rest of the body is dependent on to function normally. We're talking about the orthopedic system, the neurological system, and the metabolic system, or the internal medicine is what we often term it as. Now, from an orthopedic standpoint, I have over 300 hours of postgraduate study, formal training, and am board eligible in orthopedics. Oftentimes, what I find is degeneration in the spine creates spinal nerve root irritation, which contributes to or causes peripheral neuropathy. From a neurological standpoint, I have over 200 hours of postgraduate study in neurology, and oftentimes this nerve root irritation results in a premature decaying or dying of nerves, the peripheral nerves and then the nerve endings, which then cause the peripheral nerve symptoms. Now, the problem doesn't end there neurologically. When the nerve endings are not working correctly, there are thousands of nerve endings in our hands and feet, and when they're not functioning normally, they don't keep the brain stimulated, and then the brain starts to shut down, and we lose all kinds of function as a result of that. And that's very complex, and difficult to figure out sometimes. Now, from a metabolic standpoint, I've had over 100 hours of functional medicine training, and what we find is oftentimes the soft tissues, due to one situation or another, have inflammation. And that inflammation is like gasoline being thrown on the fire for these neurological problems. Many of you may have experienced or been diagnosed with diabetes and diabetic neuropathy, and that's a prime example of that. But there are many other types of conditions that do the same thing, create inflammation, which is irritating to the nerves and irritate and make the peripheral neuropathy worse, if not cause it. Now, you may say, well, haven't I already been to specialists? Haven't I already been to doctors with lots of postgraduate study and with lots of letters behind their names? They didn't help me, so how do you think you can help me? Well, again, the new medical research shows that most doctors are using these older procedures. They're not up to date and current. Some of the things that I use are less than 3 months old. So we're talking about cutting edge type of examinations and treatment that is going to put you in a better place. So can I help you? That's the next question. If you're a good candidate, then your symptoms will be reduced or eliminated, your activity level will be increased, and your lifestyle will be improved or returned to normal. But what's a good candidate? Well, let me tell you. A good candidate is a person who has had this peripheral neuropathy diagnosed, has been to multiple doctors, has had multiple types of treatment, and has not responded to care. It's also a person who is still actively seeking help. And it's a person who is ready to be responsible and be a part of the process of taking care, not walking into a doctor and saying, fix me. There is activity that you have to do in addition to what I do to make it happen, to make things change. Now, if we look at the rest of the story of Thomas we were talking about, he had degenerated to the point that he was using a cane and then to a walker when he came in. Well, I received a call just a few months ago, and he said, Dr. Gossett, I want you to know that I've been doing better, and I want you to know how well I've been doing. I just finished an addition on my house. And I said, what? He said, yes. I did the foundation, the subflooring, the flooring, the stud walls, the drywall, the exterior siding. I did the windows, I did the subroof, and I did the roof. Everything all by myself. And I'm never going back to that cane, and I'm never going back to that walker. That's the kind of help you can receive too. But you have to be willing to take responsibility for your health, be willing to make the sacrifices it's going to take to, in time, energy, and expense, in order to put yourself in a better place. You can give yourself and your family 10 more years, up to 10 more years of active life and enjoying your family and life in general. So if you're interested and want to know if you're a good candidate, then call my new patient coordinator at 217-351-8040. Now, if you didn't, go ahead and get a piece of paper. It's 217-351-8040. Now, also, if you know of someone else who has peripheral neuropathy or another chronic condition that they've been to multiple doctors for and are not getting any answers and not getting any better, pass this along to them, pass this information along to them. Feel free to have them contact us, and we'd be willing to talk with them and see if they could benefit from our care. Thank you.